Welcome everyone to this Vulval Pain Society social media live, and a huge thank you for joining us for this first live stream of 2022. I'm Sheren Gaulbert, Vulval Pain Society trustee, therapist and pain science educator. Please do say hi in the comments if you're watching live, and remember you can pop your questions as we go along in the comments too. I can see there's a few of you watching. I just need to make sure that you can hear us perfectly fine. So just comment and let us know that you can. Hi, Natasha. I'm hoping your waving symbol tells us that you can hear us absolutely fine. We've got Kay Thomas as usual. Hi, Marion. We've got Kay Thomas from the VPS in the background on Facebook. And if you're watching the replay, of course, you can comment too. And as we go along today, hi, Becky. Hi, Bill. Lovely to see you here. Last year, Claudia Chisari discussed the promising results of her online acceptance and commitment therapy ACT, her treatment study in Vulvodynia. Following that live, we had questions come in about how do you practically apply ACT, or acceptance and commitment therapy. So today, as we go along, please do feel free to pop your questions up in the comments box too. And we're delighted to say Claudia is with us today. Hi, Claudia.
Hi.
Hi. And of course, you now have your PhD in Vulvodynia. So should I be calling you Dr. Claudia?
No.
Okay.
Claudia's fine. If you want doctor, but yeah, I'm happy with Claudia. First name basis. Yeah, it's nicer.
Brilliant. Listen, Claudia, let's just jump in. For anyone who didn't get the chance to, oh, by the way, if anyone's wondering why I'm looking over in a different direction and you haven't seen me do this before, it's because I've got one eye on the comments, one eye on the screen, and one eye on things we're about to share. So forgive me. I can see the comments that come in. Claudia, I was going to say, let's just jump in. And for anyone who didn't join us last time, just a quick intro, if you like, or an explanation of what ACT, or what acceptance and commitment therapy is.
Yeah, absolutely. So I'm looking into different directions too. So I'm sorry about this. I'll try to keep my head straight as I just look at notes and Sheren and the comments. So ACT stands for Acceptance and Commitment Therapy. The aim of ACT is to create a rich, full, and meaningful life while accepting the pain that inevitably goes with life. ACT gets its name for one of its core messages, which is accept your thoughts and feelings, which is the A, and be present. Choose a valued direction, C, and commit to taking action that enriches your life. That's why it's called ACT. ACT has its foundation into the way our mind and language works into creating happiness and being content, but also suffering. And basically, ACT regards the mind as a double-edged sword. You know, on the bright side, language help us make up maps and models of the world, predict and plan the future, share knowledge and learn. That's great. But there's also a dark side of language, and sometimes, you know, it's used to dwell or relieve, you know, painful events from the past, or scare ourselves by imagining unpleasant futures, reminiscing, you know, painful thoughts, painful experiences, comparing, judging, and criticizing ourselves and others, and create rules for ourselves that can be life-constricting or destructive. So this is the foundation, the language, sort of the role of language in helping us with, in alleviating suffering, but also creating suffering. For instance, when we experience painful thoughts, feelings, or sensations, we may respond in ways that may not be helpful to ourselves. So because of this, ACT teaches us to handle pain, sensations, or painful thoughts in a more helpful way. in a way that is in line with what's important to us. So it helps us clarify what's important to us and commit to taking action towards what's important to us. And this is done through a series of skills. And in a minute, I will show what the core processes of ACT are. There is a nice diagram by Russ Harris that shows what the core parts of the model are. So you can see the top is be present. The center is psychological flexibility, which is all the, is the center of all these skills. And we can divide them into be present, which is at the top. We have open up and do what matters. I'm going to walk you through each of these facets or processes so that you really understand what is the model behind ACT and how we can use some exercises to be more psychologically flexible and enhance these skills. So contacting the present moment, or be present, is also known as be here now. You might have heard of it as mindfulness. It basically means contacting the present moment in a psychologically present way, being consciously connecting and engaging in whatever is happening right now. So as humans, especially when we struggle with pain or with vulvodynia, it can be hard to stay present. And sometimes we get naturally caught up in our thoughts and we lose touch with the world around us. So contacting the present moment means flexibly bringing that awareness to the here and now, mindfulness, in a non-judgmental way, instead of drifting off into our thoughts or operating on automatic pilot. And that is very often the case, not only will we have pain, it's just, the nature of it's human nature. Our mind wanders all the time, but it's also important to bring it back to the now. And that's be present, and specifically contact with the present moment. Now let's look at open up, which is diffusion in particular. Diffusion is what you're thinking. So diffusion means learning to step back and separate and detach from our thoughts, images, or memories. So instead of getting caught up in our thoughts or being pushed around by them, we let them come and go as if they were just cars driving past outside our home. So we step back and see our thoughts for what they are, nothing more than a bunch of words or mental images or pictures. And we hold them lightly instead of clutching them tightly as if they're the ultimate truth. And this is also important in vulvodynia because we may have very painful experiences and painful encounters with respect to the way others see our pain, with respect to how we see ourselves, and that can lead us to have quite common thoughts. For example, this pain isn't, they're feeling injustice surrounding the pain. No one understands my pain. But it's rather than focusing on the meaning of the actual sentence, is how we view that sentence. So holding it tightly, like, is it really true that our life is meaningless if we have pain, or is it just a representation of our own mind? So diffusion kind of works on taking a step back, whereas mindfulness is being here and now rather than in our mind. Then we have acceptance, which is open up. This is one of the facets that gets most confused, by I would say by most people, because many people think that when it comes to acceptance, it means liking the pain or being okay with being in pain. That's not the case, obviously. It's just simply realizing that the pain is there, which is a fact, right? Sometimes, we live with vulvodynia, we have pain, but making room for it rather than resisting it. So that's a very different, quality to, just saying, oh, I'm okay with the pain is great. That's not what ACT is saying. It's just saying, look at the here and now. Are you in pain? Try to allow it to be as it is instead of fighting it, resisting it. Because sometimes it's that resistance to the pain that creates more suffering than the pain itself. And of course, it's great if there's no pain, but sometimes there is.
Now, often, Claudia, people will say, but if I just accept it, that's giving in to it. That's giving up. Or what would you say to that?
So acceptance is about not being overwhelmed by it, or running from it or trying to resist it, but being open up to the fact that the pain is there, rather than struggling with the pain. So it's not to say I have to be okay with being in pain. It's just seeing that the pain is right now here, and then not let ourselves get overwhelmed by that and act. So sort of clarifying what we want to do about it, right? And then act based on that. So, for example, if we're in pain and we are sort of having a bit of a struggle with the pain, we're resisting the pain, and of course this creates a lot of suffering, a lot of it might make us upset, and then as a result of the pain, we're upset, and then we stay in bed, for example, because it just makes us feel low, and then but we don't do anything about the pain. So, for example, if the goal is to have a better quality of life and find another treatment, but because of how overwhelmed we feel by the pain, we do nothing. See, that's the problem. So it's just allowing it to be while it's there, and then making room for what's important, acting to seek the therapy, do whatever is important to us, go out with our friends. Because if we let it have a lot of space in our mind, then of course there's no room for anything else. Okay, so the next one is a bit difficult, and it's actually quite hard to explain, but I'll try my best. So it's called self as context, which is up there next to the be present, and is also referred as to pure awareness. So in ACT, there are two distinct elements of the mind: the thinking self, when we think and memorize and learn and whatever, and the observing self. So we're interested in the observing self. So it's the aspect of us that's aware that we're thinking. So not the thinking, the awareness that we're thinking, feeling, sensing. So again, it has a bit of a quality to the contact, to the present moment, to mindfulness. So it's just being aware that we are thinking, or we're doing whatever with our mind, and that's called pure awareness. Now the last two are the most, I would say they're the easiest ones, and they're at the end, where it says do what matters, and you can see committed action and values. Now we've talked about being in the present moment, and instead in sort of not resisting the pain, or not let ourselves get overwhelmed by the pain, and also taking what our mind thinks lightly. But also it's important that we do things, we take actions that make our life better, or more meaningful, or closer to what we want. And the first step is to clarify what's important to us. It's also called values. So values describe how we want to behave on an ongoing basis. What is important to us? What do we want? I'm being a bit philosophical, but what do we want to do on this planet? What is it that truly matters to us in the big picture? So clarifying values is an essential step in creating a meaningful life. If we don't know what's important to us, we can't really act based on that. We can't do anything because we don't know what's important to us. So ACT helps us clarifying these values. And committed action is it means taking action that is guided by our values. So it's the behavioral part, right? For example, if we decide that despite the pain, we want to be close to our partner, that's a value. And then the committed action is, I don't know, going for dinner, going to the movies. So it's very important that, all these processes come together into a behavior, so that we won't, we move in the chosen direction that is important to us. But of course, the first step is having that values clarified, because of course it's all well and good to know our values, but if we don't act in accordance to the values, our life doesn't actually become as rich and full and meaningful as we want. So these are all the parts of this model that's called psychological flexibility, and this is the model that's behind ACT. I don't know if there are any questions, actually.
And Claudia. No, we've got quite a few people watching. No questions as yet. I know last year when you presented, it was with the exciting news that you'd done some research into this online act for Vulvodynia, and that the results were really, really promising. And so, how does this translate then into, you did the kind of the online study, and again, you can touch upon the elements of that if you wish, just as a refresher. But how can people take this model of psychological flexibility? Are there particular techniques or tools that people can go away and start utilizing straight away or practicing straight away? Is it something about, you tell us.
Okay, so there are a couple of exercises that I'm going to show today, 2 or 3, depending on the time that we have left, that are act based. So one will be about increasing present moment awareness. One will be clarifying values, I think, and one of them will be on cognitive diffusion. So stepping back from the thoughts that we have, and we can use these skills all the time, right? Headspace, is an example of that. There's that mindfulness sort of exercise that you do every day. ACT is a little bit more complicated because there are all these facets that are in addition to mindfulness. So of course, that means that you need someone who is qualified in delivering ACT. But that doesn't mean you can do a few exercises that sometimes can be helpful, like the ones we're trying now. And that might give you an idea of how ACT works, and if it's something you like, and maybe you can sort of practice it with someone who is a healthcare professional in the field and take advantage of that if that's what you want. With regards to the study, I mean, I can give a little bit of an overview if you want.
Yeah, let's do that.
So we did an online study of, I think, 7 to 9 women with Vulvodynia. I'm really sorry, I'm not really good with numbers, but they were women who had either provoked vestibulodynia or mixed or spontaneous types of Vulvodynia, and we tried to see if ACT worked at improving pain interference, which is to what extent does their pain interfere with our enjoyment of life, our ability to sleep, or all the sort of quality of life things that we hold dear. And then we also wanted to see if it improves sexual functioning and satisfaction, because we know that when you live with pain that can also be sexual pain, like Vulvodynia, there might be some difficulties with regards to sex. So we wanted to see if ACT improved that, and also we wanted to see if depression, which is sometimes, of course, in living with a long-term condition, can be one of the struggles people have. It can also be improved by ACT. So we had this sort of pain interference, we had the sexual side, and we had the emotional functioning or depression side. So what we did was we gave access to an app to the participants, where they could log their pain levels every day, pain interference, depression, and sexual functioning and satisfaction every day for a series of days. And that during this period, there was no therapy. So we just wanted to see how they were without the therapy, and then start the therapy and continue with the exercise, with the diaries, to see if there was a difference. Like, have the pain levels of interference level gone down? Is the sexual functioning better? Is the depression lower? And we could only know that by knowing how they were before the therapy and during the therapy, and compare the 2 times. So the therapy consisted in an online portal designed by Lance McCracken and Whitney Scott. And they've been doing it on this portal has been already used in other studies of people with other types of pain. And participants could log in once a week, and they could do a series of exercises that were based on ACT. So the therapy was ACT-based. And in addition to that, we also attached a manual that was more Vulvodynia focused just because the ACT therapy was just on generic chronic pain, and we wanted to have something that's tailored to women. So we had these two components of the therapy, ACT plus the manual. And then we just wanted to compare, did they do a lot better following the therapy, or did they not, and what happened? And we found that women improved on at least one of these outcomes of pain interference, or sexual outcome, or actually that would be it, because the only thing we didn't find was the improvement in depression. We don't know exactly why. It could have been that, the intervention is online. It was a short intervention. It was around 2 months. Maybe it wasn't enough. At the end, we only probably scratched the surface of what we all know is the nature of living with vulvodynia, diagnostic delays, many years of pain. So, a 2-month intervention led to some benefits. But of course, that didn't mean that it improved everything to a great extent. But it was preliminary, and we did find that ACT was beneficial, at least on some parts, some outcomes for women with vulvodynia. So that was the study.
There's a question here. I don't know if you've spotted it. Someone's asked, will that portal you've mentioned in the study be made available to the public?
Unfortunately, it's not my portal. It's not available to the public. It has a license. But it's not available. No, sorry about this.
But you are going to be sharing some tips today.
And they're taken from the manual. So the very same manual that I used during this intervention are the same exercises that I'm going to be showing today.
Yeah. So what do you want to start off with in terms of something practical? We've got a comment here. This is great. I'd love to learn more about ACT. What makes you happy? What makes you you is a question I've added since listening to the last talk. Values-based goals have changed my practice. Thanks. So Anna, I don't know whether you're a healthcare provider. I don't know whether you're a physio or a therapist, but thank you for that comment. So what are you going to share with us first, Claudia?
Okay. So I'm going to share an exercise that's called labeling thought exercise. So I'm going to start with a bit of a background, and then we can go through the exercise together. So we can use this labeling thoughts exercise whenever we're struggling with some of the thoughts that can make us feel angry or disconnected from others. And these thoughts, they can happen when we're living with, pain or not, actually. But, in the specific context of vulvodynia, there are a lot of these thoughts, like no one understands my pain, everything is unfair, no one understands my condition. And we can use this exercise to understand how we can respond differently to thoughts. So, first thing first, identify a thought that often makes you feel angry, such as no one understands my condition, or it all seems so unfair. If the thought is quite long, try to shorten it in a few words. So in this case, the thought could be no one understands. I'll give you a couple of seconds to think about that thought. With that particular thought in mind, focus on the short thought. Try to believe it as if it was true for 20 seconds and repeating it. Think, how is that like in your mind? Now, let's rephrase the thought that we just had in our mind as follows. I'm having the thought that, and then we add the thought that troubles us. So if, the initial phrase is no one understands my condition, no one understands. It could be I'm having the thought that no one understands. Experience the thought this way for around 20 seconds. So think again, what was this time like? Next, let's rephrase the thought as follows. I'm noticing that I'm having the thought that. So it was, it was, I'm having the thought that, and now it's, I'm noticing that I'm having the thought that. Adding the thought that troubles you and focusing on this for around 20 seconds again. Now, what happens this time when you experience the thought phrase that way? So, was there a difference between the beginning and then the second part of the exercise when we were going through the same, well, when we were going through the thought, but with the added parts at the beginning, sorry.
And do put your comments in the comment box and let us know. And of course, what that process is doing is going from a belief held tightly to kind of just noticing it's just a thought. So you're removing yourself from it. You're not in it, holding it tightly. And then that second layer of removal, but I'm noticing I'm having the thought that. And so again, it comes down to that sort of holding it lightly. So it's just that noticing, and you're stepping away from it in that way. It'd be lovely to hear your comments on what you found doing that exercise. We're going to comment from Emily just saying it definitely helps to disconnect myself from the negative thought.
Yeah, that's the goal. It's sometimes we are so entangled in the thought, right? When I was explaining cognitive fusion is, we fuse, that's how it's explained with the thought as if it was the ultimate truth and there's no other explanation for why we're thinking that way, and we're completely losing sight of the here and now. Whereas by adding parts, like you were saying, I'm having the thought that, I'm noticing is part of present moment awareness, right? Notice your surroundings, notice what your mind is going through. And so taking a step back. So there is an element of cognitive fusion, diffusion, and present moment awareness into the both. So to be here and now.
Yeah. Bill Taylor, the brilliant pelvic health physio, says it definitely seems to objectify the thought. Yeah, so it's not, it's not subjective anymore. You're against that separation, isn't it? Anna, who has let us know that she's a pelvic health physio, she says it's so useful to feel the difference and be one step removed from the thought, and of course sort of two steps removed from the thought when you're in that present moment. Yeah, absolutely. Good comments.
So, of course, going forward, you can use this exercise to your own self-talk. And anytime you experience feelings of anger or thoughts that, upset you, just like you did this time, and that might help you disengage from the thought or make it more objective, like you were saying, or taking a step back. So should we move on to the second one?
Sure.
Okay. So the second one is more concerned with awareness. And this is a bit of a longer exercise. You might have heard of it before, but I kind of adapted it a little bit to vulvar pain so that it's a little bit more relevant to the experience of vulvodynia or other exercises or other, conditions. So find a comfortable position, either in your chair or lay down, whatever, you want. Begin by bringing a general awareness to your posture. If you're lying down, extend the top of your head and bottoms of your feet gently in opposite directions. From now on, keep your eyes closed or fixed on a particular spot ahead of you if you wish. For a few minutes, become aware of your breathing. Notice the rate, depth, location, and other characteristics of your breathing. Your goal is just to pay attention. Follow your breath now for a few minutes. Now move your attention down to the left side of your body, all the way down to the toes of your left foot. Notice the spaces between the toes and as many individual sensations as you can. It can be the point of contact between the toes and shoes, socks, floor, or the temperature of your feet, and so on. This, for a minute again, will be the new focus of your attention. After focusing on the toes, move your attention up to the ankles and all the way to the thighs, paying attention to the different sensations of every region. Make space for whatever sensation is there, non-judgmentally. Next, focus on the right foot and leg, the chest, the back, the arms, the neck, and the head. Make space for whatever sensation in this region is there, non-judgmentally. When you're ready, bring your attention to your pelvis. Notice any sensations in your pelvis, lower abdomen, buttocks, and your genitals. Become aware of the region of your genitals, including sensations of warmth, weight, whatever is there in the moment. Notice on any sensations. Now that we were focusing on this area, you might notice that your mind might start making judgments about the sensations you feel, especially if there is burning pain or any type of discomfort, such as whether the sensations are pleasant, unpleasant, or neutral. There may be other thoughts coming up about these sensations or body parts. That's normal. Simply allow these thoughts to be there without reacting to them or judging yourself for having them. Bring the same gentle openness to any physical sensations you're having right now. Spend a few moments expanding your awareness to the entire body, from top to bottom this time. Try to pay attention to the individual sensations that arise and pass. Spend a minute or two like that, observing how the body feels this way. As the practice is now ending, introduce movements into your fingers and toes. Pause like that for a moment. Make an intention to open your eyes and then simply open them. Now, thank yourself for taking this time to bring a non-judgmental awareness to your body. Again, this doesn't have to be 100% or, there's no right or wrong. It's just, and obviously the mind wanders all the time. That's the nature of the mind. That doesn't mean you're doing the exercise wrong. It's about bringing it back every time it just wanders off, which again is just normal. And remember that you can always access this state of awareness anytime, even in moments where there may be less awareness for whatever reason, for example, during your intimacy, by consciously and openly attending to the sensations of your body. And this can be a way to let go of the struggle with certain parts of your body and bring a sense of kindness to yourself for whatever you're feeling.
I love how throughout that, you presented this as it's a non-judgmental practice, every step of the way. And absolutely, we're all human. The mind does wander. It's perfectly natural for it to wander, but it's just gently bringing it back. And as you're noticing sensations, you're not putting any meaning upon them, nothing like that. You're just noticing what is. And I love that you repeated that throughout. And how you wrapped it up at the end, open your eyes and thank yourself. That kindness to yourself. That's a beautiful way for that self-kindness, that self-love that so often I think with vulval pain and with persisting pain that we can forget. And this isn't about getting things 100% right. It is just what it is in the moment, and then being kind to yourself for just taking that action. We've had some nice comments in someone saying psychosexual therapy helped me so much with internal or vulval pain. Oh, and this society is amazing. Thank you. Thank you for being here. There's a specific question about what to do about burning nerve pain. I would say, feel free to reach out to us. And we do have a number of other live stream videos as well, without getting into too much detail on that one at the moment. And I'll mention that again at the end so that you can go and have a look at those. You may have some of your questions answered and then be pointed in an appropriate direction for you. Esther's asking, is it normal? Esther, you're going to have to give us a little bit more than that. Is what normal? Hopefully she'll fill us in on what she means by that. Anything you wanted to mention on that particular practice, Claudia?
So that practice taps into one of I think the first part the first part of the ACT model I was explaining, which is present moment awareness. And, it's being there, but not only being there, it's being there non-judgmentally. And I think when it comes to persistent pain, and particularly women's pain, there's a lot of judgment, which is unfortunately, I'm not going to go into the details as to why, but this can be very upsetting for the person living with it. And sometimes just being there without that judgment can make us feel a little bit better. Just attending to the sensations. And it's not our fault we have pain. It's just what it is. So I think, sort of attending to the sensations, whether they're painful or not, sometimes it's just helpful without struggling too much with the fact that we do have it, because you're not being judgmental about it. And then with respect to this exercise that's called the body scan, I forgot what I wanted to say. Oh, yes. Okay. So sometimes, when you think about pain, you just have this thought, oh, I'm in pain, right? And it's like a very overwhelming sensation. And we have, we have persistent pain every day, and then every day we have some level of pain. But is the pain always there? Is it there every day, all day? Because sometimes we just get stuck into this thought, I'm in pain because I'm being in pain, 1 hour of the day. But what we're not focusing on is all the other hours we don't have pain. And I think, bringing this awareness to the body also helps you understand whether I'm in pain right now. Where am I in pain? It could be sometimes I have pelvic pain and vaginal pain, but sometimes I just have pelvic pain. And has it changed from yesterday? Because using a blank statement, I'm in pain, sometimes can make us feel like nothing is ever changing. But sometimes the pain does change. It gets worse, gets better. And I think understanding the pain is not always the same way can be but it's the changeable experience, can be quite free and quite interesting, instead of thinking it's always there, not changing. But if you really tune in, the pain does change, even if it's a little bit, even if it gets only worse, which is, again, something that is important to acknowledge, right? So yeah, it's the changeable nature of pain. And I think this exercise can help bring awareness to that.
We do hear that often, don't we? I'm having a bad day, or it's been a really bad week. And actually, things are always shifting within us. And this exercise brings that awareness of things are shifting, and they may be different. It may be a slightly different location or a different type of discomfort. And just becoming aware of the body as a whole, and getting a sense of that. Esther's question was about her vulva, vagina feels hollow and not there, like it's an empty void and empty tenderness. Is that normal to feel when doing the body scan? Do you want to take that question, Claudia?
I think there's no right or wrong. If that's the sensations you felt, that's the sensation you felt. And I think then what you might want to ask is why do I feel, not in a judgmental way, it's more of a curiosity rather than judgment sort of thing. Again, the acknowledgement of the sensation. Why is that the case? Trying to not going down the rabbit hole of all these ideas and judgments that we may have surrounding the pain. But whatever you feel, whether it's negative or positive, or it's yours, it's your body. So when you do the body scan, any sensation is right. Again.
It is what it is in that moment, and we are just talking about present awareness. And Esther, that sort of empty void, you may notice with this practice that that shifts for you as well with time. And often with vulval pain and with persisting pain, there can be this sense of almost dissociating as a safety response. And it's almost a body schema thing, this interoceptive sense of where things are. When you take a drink down, you can sort of feel it going down. That's our sort of interoceptive sense. That's this feeling of what's happening within our body and what's going on. And sometimes with pain, we almost can separate out from it a little bit at times where it's a bit too much. So there's a possibility that empty void is to do with that. And something like this body scan practice, because it's so gentle, it's non-judgmental, can help you experience your body in a safer way over a period of time. You may notice that shifting. So, feel free to let us know how you get on with that, Esther.
Yeah, actually, when you were saying this, it made me think, sometimes we all react differently to pain. Sometimes it's a complete disconnect from that area, right? It's that, what you were saying, sometimes it's focusing only on that. So, and not attending to any of other body sensations, but, we're more than the vulvar pain. And sometimes it's again, normal, completely natural to exclusively focus on the pain, because pain is a sign that something is not right. And naturally, as humans, we focus on that. But when it comes to persistent pain, sometimes it's okay it's good for us to bring awareness to all the other parts of the body and realize, oh, hold on, I do have pain there, but I don't have pain there, and today is like that, but yesterday was like that, and sort of the change is with that. So I think whether it's, emptiness, whether it's pain, our mind does whatever it wants, but that awareness can help us figure out how we're reacting to the pain too.
And throughout it all, just non-judgmental, and that kindness to yourself. So whatever it is for you is what it is for you in that moment. And you have a third exercise for us, I think, Claudia, too.
Yeah. So we tapped in, we talked about the sort of stepping back from thoughts. We talked about being in the present moment, not judgmentally. Now, the third part, I thought it would be interesting to go through an exercise that it's about values and acting, committed action in relationships. So clarifying what's important to us and perhaps committing to that. So this exercise has been called, how do you want to act in your relationships? Now, when we're struggling with vulvodynia or any types of pain, we may struggle to connect with our values or what's important to us. This exercise will tap into our values and engagement into our relationships. This doesn't focus directly on sex or sexual relationships. It's just any type of relationship, because it doesn't really matter. It's whomever is important to us, So I'm going to read through these steps, and then you can close your eyes or fix your gaze on a point. as I go through each step. So sit upright in a chair or with your shoulders back slightly and your chin up in a posture of alertness and openness. Allow yourself to take a few deep breaths. Slowly inhale and exhale. Focus on your breathing as a way to focus on what's happening right now. Bring to mind a person that you care about. This could be your partner, family member, friend, or even a colleague. You might have a good relationship with this person, or you might want this relationship to be better. All that matters is that this person is important to you. Bring to mind what this person looks like and sounds like. Now, imagine how this person would treat you if they were treating you from a place of love, care, and respect. What would this person say to you? How would they speak to you? What would this person do to show you they care about you? Notice any feelings or thoughts that show up for you as you imagine how this caring and respectful person treats you. And take a few moments focusing on that. Keep in mind the same person you care about, the same way we've done for the last couple of minutes. How could you show this person that they're important to you? What could you say or do to show this person that you care for them? Is it similar or different to how they make you feel loved, cared for, and respected? These actions might include saying please and thank you more often, giving a hug or a kiss to someone you love, sending a message or calling someone to see how they are, doing a small favor for someone, or telling them how much they mean to you. Of course, these are just some ideas, and these ideas can be different to each person, and you may have thought of different actions. That's fine too. Imagine what it would be like to do these caring actions, even when you're feeling angry or frustrated or in pain. Notice any feelings or thoughts that show up for you as you imagine this. Now return to focus on your breathing for a few moments. When you're ready, you can gently open your eyes or unfix your gaze. Now the commitment part. Would you be willing to choose one of these caring actions for the person you identified in the last exercise to do in the next day or so? Remember, we all fail to live by our values sometimes. Yet every day we can make a choice to recommit to the people and things that we care about in life. And anger or frustration can block us from acting as we wish to. And it may not be our choice to feel angry or frustrated, but we can choose to give in to anger or to recommit to small actions that make your life more meaningful, even with anger coming along for the ride.
love to hear some comments from people who were just guided through that practice, just to see what it was like for you. And perhaps if you're, perhaps if you want to share the action you're going to take, or just to say, I'm committing to taking that action. You don't even have to tell us exactly what it is you saw or what you're committing to, just that you're committed to it. As those comments come in, I'm just going to read out this one that's come in on YouTube. Someone's saying, you mentioned what to do if you're only having pain at certain times, but have burning pain all day except at night. And of course, when you say except at night, there is a time there, of course. And again, with symptoms, whilst it might be there all the time, there may be different degrees of it. And also, what are we doing without focus during that time? Any thoughts on that, Claudia?
I was going to say the same. I mean, it can be quite distressing, of course, to have pain all day, but it might not be all day the same way. It might be interesting to observe pain in a more curious way, which sounds very hard to do, but it could be something worth digging into, because sometimes we see pain as a sign of damage or of a problem, and it, of course, it is the sign that something is not right, but that doesn't mean we can't also sort of explore how this pain changes, how it varies. And I mean, if it doesn't vary and if it's very severe, I think the best thing to do is perhaps to also to liaise with a healthcare professional who can help with the pain. I mean, all these techniques help us, I guess, being connected to what's important to us, taking these actions, to get closer to the people we want to, and being more in the present moment and understanding our pain. But the pain itself, also needs its own therapeutic approach that can be from a physiotherapist or doctor, gynae. So I think that's also very important. And I think if you attend to, your sensations and you realize that pain is always there, and it's something, and there's something you want to do about it, then that's perfectly in line with ACT, right? You're clarifying that the pain is causing you distress, but you want to do something about it to feel better. That's completely in line with what ACT says. So again, it's not to say that you need to accept this pain sort of passively, but observing it and doing whatever makes your life better.
Kay's jumped in. Have you seen Kay from the Vulval Pain Society? She's jumped in and said, I'm going to commit to saying more positive things and pausing before I have a wind. It's a good one.
It is.
Yeah. These are, we've got, Bill. Tomorrow I'm going to be kinder to someone whose behaviour I've been finding very frustrating lately. That's a good one. Yeah. Claudia, any points to wrap up as we're coming to the end of our hour?
Well, I think, again, these skills these exercises that we went through are just give you a bit of an overview of what ACT can do, and, what the exercises that can be given with ACT. Of course, you'll see with most things, the most benefit by using the skills regularly in your daily life. And these are just a few exercises that might give you a bit of an idea of whether ACT is something that's suitable to you, whether something it's, you want to dig into, a little bit more. And yeah, like all things, practice makes perfect. So, of course, this state of awareness, this state of commitment, it's something to practice every day, or regularly anyways. But yeah, I hope this was useful. I hope this, we always talk about ACT, but sometimes it's hard to see, what is it in practice. And I hope this gave you a little bit of a chance to understand whether it's something that you might find useful in living with vulvar pain or persistent pain. So.
Yeah, that's brilliant, Claudia. And we're talking about modifiers here, aren't we? There are factors that modify the pain experience for people, and ACT sits very well within all of that. The kind of non-judgmental practice, taking action, values-based actions, all of that. So we've got just a few final comments from people watching. I think it would be a nice way for us to wrap up. Esther says, I want to commit to breathing properly. And whatever that might mean for you, whether that means, diaphragmatic breathing, a fuller breath, or you're just going to take, whether that means in your daily day-to-day life, there may be other people who think, I want that one for myself. It doesn't necessarily mean you just lie down and practice diaphragmatic breathing for a while. It might just be in your day-to-day life, you'll become aware of how you're breathing and change it. So whatever that means for you, Esther, and if anyone else wants to try that on, they can too. Marion Jones, a good friend of ours, says, gosh, you must have seen my awareness post today. I will commit to being more positive. Brilliant, Marion. Anna says, I'm going to pause before I get frustrated. It's easy to default and not pay attention to what you're about to say or do. These are great life skills in addition to helping our work lives. Thanks. Lovely. Bill's just saying thanks for a great insight into ACT. Great webinar, Vulval Pain Society. Thank you, Bill. Thank you, everyone who's joined us, and thank you, Claudia. That was brilliant. We do, as you say, we do hear about ACT, and it's nice to know how to put this into practice. I've popped up a link to all our live stream, so you can. I noticed a few people joined a little bit later on, so you can rewatch from the beginning. Or rewatch any of the 19 live streams we did last year on our Facebook events page, and I've put a link up to that. And they are also last year's live streams. I've put up a playlist of our live streams. They're on YouTube, so you can also access them there. Before you look at those links and click on those, let me tell you what's coming up next time. We have another hugely popular speaker from last year back on, Dr. Angela Wright, clinical sexologist, menopause specialist and GP. Last time, she introduced how the vagina and vulva are affected by menopause. And on Thursday, the 24th of March at 7 p.m. GMT, she'll take it a little further into sexual impacts like vaginismus and anorgasmia, and then special cases like women after cancer, women after surgery, how hormones and illness can affect vulval health and sexuality. So looking forward to learning more from Dr. Angela Wright next time. In the meantime, we are on Twitter and Facebook, so do follow us to be kept up to date, and feel free to reach out to us. Whether you live with vulval pain or you're a clinician, a healthcare provider, a physio, researcher, we really thank you for continuing to share our posts, our tweets that can be really useful to get resources and messages out to more people. So we really thank you for continuing to do that. So we hope you can join us with Dr. Angela Wright, clinical sexologist, menopause specialist, on Thursday, the 24th of March at 7 p.m. That is all from the VPS today. Thank you again to our research advisor, Claudia Chisari.
Thank you.
And thank you all for joining us this time, and we will catch up with you next time. Cheerio for now. Bye.